India has now recorded its highest COVID surge, this year's highest COVID surge, with 26,291 fresh infections reported in just over the last 24 hours. The last time India recorded over 26,000 cases was in December last year. The country is once again witnessing a resurgence of COVID-19 cases since the last month. India has now recorded 1,58,725 deaths, with 118 in just the last 24 hours. Data issued by the Health Ministry suggests the total active caseload here in the country has gone up to 2,19,262, while the recovery rate has dropped to 96.68% from 98%. Health experts now have also raised concerns over the second wave of coronavirus. Maharashtra alone has 60% of the active caseload in the country. The state has now recorded over 16,000 cases in a day. Andhra, Kerala, Karnataka, Tamil Nadu are among those worst hit states. I'm quickly going to cut across to Sneha Murdani, who's now been tracking the COVID-19 case spiral in the country, to give us some perspective. Over to you, Sneha.
Thanks for that, Nabila. Unfortunately, in the country, we're seeing a massive spike in the number of COVID-19 cases, and this after in the month of January and February, there was a brief lull where over a period of time, we were seeing continuously below 10,000 cases in the entire country, round about 8,000 to 9,000 cases at least over a week. But that has now gone up drastically. So here's how it really looks like. Unfortunately, keeping the number of total active cases below 2 lakh for many weeks together, we have now crossed the 2 lakh figure. This is rather worrying. 2,19,262 active cases of COVID-19 in the entire country. Our deaths at about 1.40%. Our fatality rate continues to be on the lower side. India has managed to keep it below 2%. Some states like Kerala are keeping it at less than 1%. Deaths in total numbers is at 1,58,725. And remember, there has been an increase in the number of total deaths that every single day the entire country is reporting. For example, on Saturday, we had seen round about 161 deaths. This figure too was less than 100 for the longest time. Look at our recoveries, hovering around 97%. This is what the recoveries essentially look like in the country. Milind Sharma is getting us more details. Milind tracks the Health Ministry for us. Milind, extremely important for the centre to intervene, and it has done so. The centre has in fact looked at many states and sent central teams to assess the situation, not just that, to handhold the states, given the fact that at the end of the day, health is a state subject. Just tell us, what are your sources really telling you about what are the findings and the shortcomings that the central teams have seen in many of these states?
Well, Sneha, it's been told by the Health Ministry that even the central teams that are looking at a spike in cases, especially in the states of Maharashtra, Kerala, as well as Punjab, they have squarely put the blame on overcrowding of people in various places. Many a times we have also heard the Health Ministry say in press conferences that it's due to the overcrowding in ceremonies, people not wearing a mask, people not following social distancing norms, people not adhering to COVID-appropriate behavior is one of the reasons that there have been surge in the states, especially in Maharashtra, where sources tell us that they have found variants and mutant strains as well, especially in districts of Yavatmal, Amravati and Akola. But there has been a surge in these districts, and therefore they are also facing a conditional or partial lockdown, especially with the areas like Nagpur going for full lockdown, Nashik going for a restricted lockdown. And these have been the kind of steps that the states have been asked to take. However, the findings of why these cases are increasing again, and the possibility of the fact that we could be looking at another wave, is very certain. And which is why the central government is being cautious at this point to check why there is a rise in the COVID-19 cases in the state. And it's also trying to figure out what are the other possible reasons. Is quarantining not happening? The testing in the state is also going on. Are people now become so aware that they are not coming out and testing themselves or self-quarantining themselves without informing the authorities? And that is something that authorities in Maharashtra are taking very seriously, because we've heard reports of people not coming forward and testing, not stepping out, but having COVID-19 symptoms. and giving it and spreading it to families and buildings. So that is one very crucial aspect of case tracking and tracing whoever has been infected with COVID-19, which is not being overlooked by the government at this point. And let me tell you that it's not just these three states, but also Karnataka, Tamil Nadu, as well as Gujarat that are looking at a spike in COVID-19 cases furthermore.
Absolutely. Milind, thanks for getting us up to speed with that. Milind mentioned testing.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.